In this presentation, I'm going to show you how to mobilize and to manipulate the middle part of the cervical spine, and also we will drift towards the lower part as well. So most pathology within the cervical tends to be more C4, C5, C5, C6, and C6 and C7. So no doubt there'll come a time, if you're an osteopath, chiropractor, physiotherapist, etc., or manipulative therapist, where you might want to ascertain a problem within the middle cervical and a technique where we can consider opening, say, the facet joints in here. Now, the first vertebra you feel will be C2. So let's say, for instance, you find C2. It's almost like a thickness of a finger on an average size hand. So you can almost like put your finger and say on C2, next finger on C3, next finger on C4, next finger on C5. So you know roughly where the fingers would be. So if you wanted to manipulate, say, 4, 5 or 5, 6, then you can almost like work out by the fingers, and you can also come onto the articular or the spinous process. So there's a few ways of doing it, but as a quick rule, the finger to the next one is naturally going to guide you to 2 to 3 to 4 to 5. So that could be one almost simplistic way of placement of the hand. It's not exact, okay, but it gives you an idea. So if I use my friend here, and if I rotate his neck and I come onto, you're not going to be able to see so well because I'm palpating the posterior. So if I come onto C2, and then I can go to C3 and C4, or if I said what I'm doing now, so C2, follow it around onto the articular, I can almost put my little finger there and the next one to the next one to the next one, and that would roughly take me onto C2 to 3, 3 to 4, 4 to 5. You can also go to the base of the neck and find the most prominent vertebra, which would be known as C7, and then come up to C6, and then come into C5. So again, you can sort of find the area accordingly. So let's say, for instance, I want to do, say, the middle side, C4, C5. So if I find C2 to 3 to 4, and what I'm going to do is put my MCP joint on that area of C4, okay? So I'm going to go from 2 to 3 to 4, and then from here I'm going to slowly side bend my patient towards my MCP joint and initiate a rotation, okay? So I'm in that sort of position in there. Now, this is known as coupled motion, and I'm inducing what we call a type 1 motion. So the neck follows a type 2, which is a side bend and rotate to the same side. So if you wanted to mobilize or cavitate, you have to go against its natural motion. So a side bending towards and a rotation away. So when you come onto that area, you're going to come in. So I'm using my right hand to guide me, but my left hand is also encouraging the rotation as well. So the upper cervical C1-2 is more towards the eye, but you're still going to follow that natural rotatory movement. Okay, it's not going to be too low, too high. So where your hands are, you are going to follow that natural rotation, not directly towards the eye, but it's going to be in that rotation movement because the facet joints are aligned more in a horizontal plane. So they have to be opened, if you like, by doing a rotation thrust. So from this position, we can just mobilize. So this is just a simple mobilizing for C4 and C5 from that area. So I'll just say how many, okay, maybe 5 or so, just to mobilize it. If you're going to do a cavitation technique, I would normally suggest that the patient takes a breath in, please. I'm not going to do a full cavitation, so I'm going to side bend, rotate, and then from there, the movement will be a quick movement like this, but a bit quicker, okay? Because obviously I've used my friend to do many manipulations, I feel that we don't need to do too many of them for the demonstration. So that would be the angle, so with more side bending towards rotation away. When you feel the bind, you can use the movement, and if you are mobilizing, it is a mobilization technique, but as soon as you start to thrust, you've crossed that line, and now it's a manipulative technique known as the HVT. If you wanted to do the lower ones, not so easy to get to, naturally the MCP joint has to be as low as you can go if you want to go down to C6 and C7. So I normally will do a bit more side bending down to the level and rotation in that position in here. So I'm going to side bend further, rotation, not really rotating further because it's the side bending down, and then you initiate a rotation that would come there. Just watch the thumb, but the thumb has to go somewhere. Okay, so then from there, I'm going to then use my right hand and the left hand to lock, 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 and the mobilizing would be this, and the thrust would be that, but a bit faster. Okay, so that's how you manipulate the middle to the lower cervical spine.